अरे, तुम इतनी तेजी से बिना देखे कैसे टाइप कर लेते हो? कोई साथ बैठा है क्या?
नहीं यार, अब मुझे किसी की जरूरत नहीं। मेरे पास है स्वलेखन टाइपिंग ट्यूटर।
स्वलेखन, स्वलेखन। आज खुद को आजमाओ, निर्भरता की जंजीर तोड़ो, सीखो टाइपिंग स्वलेखन से, अपने हक की जंग लड़ो। मराठी, हिंदी, इंग्लिश सब एक ऐप में फ्री, 78 मजेदार लेसन्स से सीखना हुआ इजी। स्वलेखन से आपके विचार अब बने पहचान, स्वलेखन से लिखो खुद और छू लो आसमान। स्वलेखन।
निवांत अंधमुक्त विकासालय लेकर आए हैं स्वलेखन टाइपिंग ट्यूटर, एक अनोखा सेल्फ लर्निंग अनुभव जो रिकॉर्डेड वॉइस के साथ आपको खुद सिखाएगा टाइपिंग की कला।
स्वलेखन।
मोबाइल के लिए प्ले स्टोर से और विंडोज पीसी या लैपटॉप के लिए SWALEKHAN यानी कि swalekhan.org से ऐप डाउनलोड करें या फिर कॉल करें 9923772375 पर।
स्वलेखन।
डिपार्टमेंट ऑफ एम्पावरमेंट ऑफ पर्सन्स विद डिसेबिलिटीज लेकर आया है सुगम्य भारत ऐप। इस ऐप के जरिए आप एक्सेसिबिलिटी से जुड़ी शिकायतें, फीडबैक, इंफॉर्मेशन और सर्कुलर, आने वाले इवेंट्स, राष्ट्रीय हेल्पलाइन और सरकारी योजनाओं का लाभ एक ही जगह ले सकते हैं। तो आज ही सुगम्य भारत ऐप अपने प्ले स्टोर या ऐप स्टोर से डाउनलोड करें। This app is developed by the Department of Empowerment of Persons with Disabilities, revamped by Mission Accessibility in collaboration with iSTEM, NAB Delhi and Vision Divyang Foundation. This initiative is supported by the SBI Foundation. आज ही डाउनलोड करें सुगम्य भारत ऐप।
जी दोस्तों, नमस्कार, आदाब, सत श्री अकाल। मैं दानिश महाजन प्रोग्राम बदलता दौर में आपका स्वागत करता हूं। इस बार जब पद्म श्री अवार्ड्स का अनाउंसमेंट हुआ तो हमारे लिए बेहद खुशी की बात थी, क्योंकि हमारे सेक्टर में से डॉक्टर सुरेश हनागवाडी जी को पद्म श्री कन्फर्ड किया गया, तो पूरे सेक्टर ने सेलिब्रेट किया। तो आज हम आपको मिलवाने जा रहे हैं डॉक्टर साहब से, जानेंगे उनकी जिंदगी के बारे में, उनकी सर्विसेज के बारे में और कितना महत्वपूर्ण है पद्मश्री उनके लिए। तो ये सब बातें हम डॉक्टर साहब से करेंगे। डॉक्टर साहब, थैंक यू सो मच फॉर गिविंग अस टाइम एंड मेनी मेनी कांग्रेचुलेशंस।
Thank you very much. It is my privilege to get interviewed by you. Yeah.
So, Dr. Saab, tell us when you got this news, were you expecting? What was the mood and what were the feelings? How excited your family was?
Yeah. Yes. Actually, I was in Bangalore for a marriage function, and I received a call from Ministry of Home Affairs that telling that your services are recognized by Union Government, conferring Padma Shri Award. It was a really surprising thing for me. I was really, my heart beat missed actually, and yeah, I became so happy, and they asked me to give the consent, and I told definitely it is my privilege, and this award will enhance my capability to serve still more better way, and also it is an opportunity for me to create a public awareness, and yes, I accepted it.
Yeah, it's always great to receive such awards because, as you rightly said, it gives you more opportunity to aware masses. When you recognized, you got limelight in media, and that's the opportunity to aware people as much as you can. So, Dr. Saab, tell us a little bit about your childhood and your disability for our listeners.
Yeah. Actually, I am living with hemophilia. Hemophilia is a congenital disorder. It occurs since birth. And when I was diagnosed hemophilia, the pediatrician, he advised my mother not to allow him outside, get injured, only the protective nature, preventive. But those days, even the lab diagnoses were not available in the whole state. So I was diagnosed clinically, but not in the lab. So actually, in my family, hemophilia was there, and my maternal uncle also had hemophilia. And since my father was government servant, we were in Bellary, and we used to go to grandparents' house every summer vacation. And whenever I went summer vacation to spend with mama and grandparents, and when he came to know that I too have this disorder, he used to tell me, "You must become doctor or do something in this sector." And people doesn't know, doctors doesn't know about hemophilia. So because he was very badly treated, and he was angry on doctors, and he used to tell me every time. But those days, during my childhood days, I was not at all interested in medical field. I wanted to become a pilot. But one summer vacation, when we went, no, my mama had a severe headache, and he took me along with him to the hospital where now I am working. And he was telling that he has got hemophilia, and he is sensing bleed in his brain. He requested for 1 or 2 units of blood so that he will survive. But the doctor got irritated, and he told, whether I am doctor or you are doctor, he show me the reports and all those things he told. And ultimately he thought it is a sinusitis, and he prescribed antibiotics and painkillers and sent us out of the OPD. And in front of the hospital, there is one park. In that bench, he was lying down and plucking his hairs with severe pain. Even in that pain, he did not forget to tell me, "That's why you should become a doctor." So then we went back home without any treatment. And later, after entering into medical college, I realized what happens when there is a blood clot over the brain. My mama lost consciousness, and he paralyzed half of the body. And after 1 week, the whole family had to witness his death inch by inch with helplessness. And he died after 1 week. And this scene really disturbed me a lot. And why doctors doesn't know about hemophilia, why my mama did not receive proper treatment, timely treatment. And I decided at any cost, I have to become a doctor. That was the days. And even I too have hemophilia, and no facilities were there. But anyhow, with the support of my mother, parents, friends, and especially teachers who used to come home and give me notes, and so I completed my studies and got a government seat in a private medical college, that is in Davangere, JJ Medical College. Then I completed MBBS, and later realized my limitations. That is because by that time my joints were damaged, and I realized the worst disability in the coming years. And I preferred for my post graduation MD pathology. Though I got MS ophthalmology, even in the counseling they laughed at me. Why you take ophthalmology? No, I told, no, I want MD pathology only. Because of the two reasons. Number one, even if worst disability occurs, I can set up a lab and earn for my bread. And second reason is I can involve in the field of blood and serve my blood brothers and establish services, and I can work. So these are the two reasons I preferred MD pathology. I completed in Hubli, and after completion, so then by that time, slowly we started an organization, founded Karnataka Hemophilia Society in Davangere.
Right.
And I am proud to share with you those days I registered Karnataka Hemophilia Society with my first earning. That those days we used to get stipend. With that stipend, I went to the district authority and registered the society with 9 hemophilia families. So this is how we started the society, and the main hurdle was lack of awareness. We started public awareness, media awareness, and the main challenge was to arrange the treatment because these medicines are not manufactured in India. They have to be imported. One injection it costs 10,000. So that's why it was a very difficult task for us to provide treatment. Then we contacted some donors and we used to raise. But so being a teacher in the medical college, that is a great opportunity for me because most of my medical students supported me as volunteers, and they proposed a small program to raise funds in the college, and that was our first fundraising program in 96. Kusuma 96 we named, because hemophilia is known as Kusuma Roga in Kannada. So this is the first raising. Then the society started in my home, and later after this program we shifted it into a small rented house. We named it as daycare center. And after the media and so many articles, many patients started coming to us, and most of the patients are poor, and especially life-threatening bleed. We have to give the factor injection first. We affiliated with Hemophilia Federation India those days, and we started getting these medicines and started giving at subsidized cost, and poor patients at free of cost. So this is how we started. But many, especially brain bleed patient, we have to give the injection first, and if we give, who will pay for it? And if you don't give, he will die. These were the situations we started facing, and someone advised to organize one more program, inviting some celebrity. Then we contacted Dr. S.P. Balasubramaniam, and who is a very famous playback singer.
Yeah.
And when we contacted him and explained about hemophilia sufferings and all those, then we told him that we are organizing one program as we organized in 96. You please come there as a chief guest. Then he asked, what are you going to get if I come there as a chief guest? We can sell more tickets, we can get more sponsorships so that more money is collected, and so that we can bring these medicines and make it available to our patients. Then he told one word I cannot forget. So he told, you are all doctors, and God has given opportunity to you to serve the patients directly. But I am not a medical doctor, but I have a doctorate in music and singing. Please give me an opportunity to. Then we were shocked, and sir, such a mega star and mega event, we are not in a position to organize because we are not so strong enough to organize your program. Then he told, who asked you money? It is my social commitment. You need not pay a single rupee. I will come, and even if you are, this is my social commitment. So this is how 17th April World Hemophilia Day was celebrated by his music concert to raise funds. That was the very good event, and we really helped us to treat more and more patients. And
No,
by
he's a
that
great
time,
singer. Yeah, Malo, he has
yeah, yeah.
also done some charity for the blind
Yes,
also.
yes. Actually, in fact, he committed one day in a year for hemophilia. Don't call me for only fundraising, doctor. You, even if your children forgets their pain, I don't mind coming and sing for them. So this is the commitment he gave in 99, and he stood with us for in the last year of his life, 21 years. And every year we were not in a position to organize such a mega event, but 5 mega event in his lifetime he gave has enriched the society, brought moral support, and in the meantime, the local philanthropic woman, Srimati Kirwadi Girijamma, she came forward to donate for the site allocated by the local urban authority. And this is how Girijamma got us a site, and SPB started singing from the bottom of his heart. And as the years passed on, we could construct an exclusive building and set up all the facilities needed for blood disorders under one roof. Now we have diagnostic facilities. Earlier, patient needs was supposed to go to distant places, but now it is available. And we have set up 20 inpatient facility and physiotherapy, hydrotherapy, and also blood bank with component separation unit. Why
Wow.
blood bank? Because hemophilia patient needs factor 8, factor 9. But still rarer than hemophilia, there are bleeding disorders like factor 13 deficiency, factor 7 deficiency, fibrinogen deficiency, and van Willebrand disease among women. These are all inherited, and there is no specific factor concentrate, and that's why the blood bank was very much necessary. And with the help of my old students and my friends, we established blood bank also, and we decided as per the government of India's gazette notification, hemophilia, thalassemia, sickle cell disorders needs to the products needs to be given at free of cost. But being a bleeding disorder community organization, we have taken a approval in our board to give any amount, any blood products, whether including in addition to hemophilia, any inherited bleeding disorder walks into our center, we give totally free of cost.
Yes.
And by the support of philanthropists, and now we have a center exclusively for inherited bleeding disorders, and all the facilities under one roof. And one, I am proud to share with you, all these facilities are given free of cost. Even no admission fee, physiotherapy, everything is free. Only one hurdle is we are not able to give diagnostic facilities at free of cost, because it incurs reagents, equipments, and everything. That's why we have decided to give at a affordable price. But if any poorest of the poor patient comes, and we give even diagnostic facilities also at free of cost.
Wow.
And this is how the society developed. And we also advocated with the government, because ultimately government responsibility is to take care of these disorders. And on one side we say it is the fundamental right to access to the treatment as per the
So I have
constitution.
2-3 questions, Dr. Saab. One, that as you rightly said, there was no awareness when you were diagnosed with hemophilia.
Yeah.
So I have 2-3 questions. One, now it is under RPD Act. So
Yeah.
how do you think how things have changed if we have to compare with the time you diagnosed with hemophilia and what is the current situation now? And did you face personally any discrimination or stigma by the society? And what were the challenges during your education and employment?
Yeah, very good question you asked. Actually, we advocated with the government to include hemophilia, thalassemia, sickle cell disorder under RPWD Act. Unfortunately, the 21 disabilities are covered under this act, and we were extremely happy about getting the support, that whether it UDID, social benefits, and everything. But one painful thing happened. So actually, blood disorders are kept out of benchmark disability, and we realized those disorders comes under benchmark disability. They are eligible for job reservation. Unfortunately, these our blood brothers are denied of job reservation, and we are further advocating, and we hope our blood disorders also included under the job reservation facility. But why job reservation is needed? That is very, very important. Number one, so disability in hemophilia is preventable disability, and if not treated, it becomes a progressive disability. But all this is all preventable. So I need to stress upon the need of prophylactic treatment for all our blood brothers, so that they don't bleed, and bleeds were taken care immediately. If they don't bleed, there is no question of disability. And also a major challenge is for our children, they cannot go to schools. School absenteeism, college absenteeism is a major hurdle in becoming a fully educated. And if there is no proper education, we cannot compete in this country for appropriate jobs. We cannot take up hard jobs. We cannot take up. Okay, we need only soft job like a table work. And but one thing I want to tell at this moment, we lack only clotting protein, but not zeal in the life, but not skill in our life, in our capability. Everything we are equally competent, but only the government, society has to give us a favorable environment to study well. This is possible only by giving job reservation. Even without job reservation, you asked about my suffering. Yes, it is really horrible because during my school days, during my college days, when I see my peers playing cricket and hockey and all those games, I used to feel very bad, and a lot of inferiority complexes I developed. And whenever any in public, no, so don't touch him, he has got hemophilia. So these kind of reactions from my friends used to make me very much depressed, and suffering. It was very painful. So even without this job reservation, I have become a doctor. I have completed my MBBS, MD, and worked in a medical college as a professor of pathology at JJ Medical College, Davangere. And the remaining time I spent for the awareness and establishing quality services for my blood brothers. So if this reservation is given, and our youths, students, they can complete their education, become competent at anybody in this world, and they can become anything in their life. They can
Right.
become doctors, engineers. Yes,
So
we
there
are
are two
capable.
more questions. One issue I have heard from the people who are diagnosed with hemophilia, health insurance is another a big challenge.
Yes,
So
yes,
most
exactly
of the
right.
companies denies. So
Yeah.
your take on that, and also some of the friends told me that the medicine given by the government is not up to the quality that we look for. Since you yourself is a doctor, so can you throw some light on this as well?
Yeah, actually, the life insurance is denied because at least that will give some great relief to the parents or the family. So, insurance policy, but now with our advocacy, one or two have accepted. But in general, the life insurance should be open for our blood brothers. Number one. Number two, another question you asked regarding
Medicine quality by the government.
yeah. Actually, this is another. So, fortunately, because of the advocacy, in fact, to tell you how we involved our state government in Karnataka. So, actually, one of the that health minister was from Sagara, Kagodu Timmappa, in 2001-2002. And when we invited him for one program in Davangere, and I had one couple living in Sagara, working as a coolie in coffee plantation, having two children with hemophilia. One child, while eating chocolate, bitten lip and started bleeding. And they went around Sagra, they went around Shimoga, and 8-10 days child was continuously bleeding. By the time someone has advised you rush to Davangere, and by the time they reached Davangere, the child was in literally shock, no pulse, and we tried admitting in emergency ward and resuscitating, but unfortunately, because of the cardiac arrest, we lost that child. Then I told the mother, your MLA, he is local MLA, he is a health minister now, he is in charge of the health policy, and you please, I prepared her to share how she lost a child to a chocolate. And the health minister was really in tears, and he looked at me. On one side you call Kusuma Roga, but you see how can a child loses its life for a chocolate. So then he immediately asked me, what are your short-term need? What are your long-term need? Even in that program on the dais, he changed the whole protocol, and he made DC, CEO, everybody to discuss what to do for this cause. And these two questions, the short-term need, I told him, we need to train all the doctors all over the state. That happened in first time in Karnataka, and the authorities were asked to organize. 3 doctors from every district were deputed to Bangalore, and we organized a state level training program for the first time in fact in India in 2001-2002. Then next question he asked, long term need. Long term need, I told, these medicines are very expensive, beyond the reach of common man, and you need to make these medicines available in all district hospital at free of cost. And immediately he took that very seriously. He contacted his principal secretary, and the file started moving in Udaan Sauda and Vikas Sauda. And by the time in 2005, for the first time in India, and Karnataka government announced 2 crore grant for procuring these medicines. But over the period of so many years, so now I am happy to share with you, National Health Mission is involved, and every state is involved collaboratively, NHM and state health, and this is how progressing towards giving these medicines. Yes, you are correct. There are some lacunae, there are some issues like central level of tendering process, because these are all life-saving medicines, and all the 12 months medicines are not available. But because of this tender issue, technical issue, and even from the company side participating in the tender, because these are all multinational companies. So these are the issues we need to address at this thing. What I suggest, central level, we need an expert committee under some aims or very big institute heads, so that we all can sit together and evolve a strategy to sort out all these technical issues and make the procurement of these medicines, quality medicines, and uninterrupted.
So, what does this Padma Shri really means to you personally, and what are your goal now from here onwards?
Yes, after receiving this award, I am really empowered to take further challenges, and I need to work with the government closely, and I want to empower the government and see that the quality service, because government now spending crores of rupees, but what is the result? We failed in preventing disability. But for this, we need to have a proper strategy so that our children are prevented from disabilities. Definitely, I work closely, because now I am retired from the college, but anyhow, I am passionate about teaching my postgraduates, But anyhow, I want to, for all these years, I have balanced my commitment as well as my profession. But now I am retired, but with a part-time thing, I can continue teaching. But main focus, I want to streamline all these policies and work closely with the government, advocate with the government, advocate our bureaucratic officers and ministers, so that our ultimate vision is hemophilia without disability, children free of pain. That is my goal in the coming at least 3 years. I am making my own plan how to address all these issues, whom to meet, whom to sensitize, and see that our blood brothers are in good hands of doctors as well as the policies.
Dr. Saab, there are people in rural area still encounters lack of awareness. They do not
Yeah.
get good medical support, or people are not really aware with regard to hemophilia in the rural area or semi-rural areas. So, two questions. What are the biggest gap you see there, and what would be your advice to the people who got diagnosed with the hemophilia at the early stage? What should they do?
Yeah, actually, to address this answer, yes, you are correct. Nearly there are about 80,000 to 1 lakh hemophilia in India, and hardly we have registered around 25-26% of the population. Still, there is a long gap. Why there are issues like this? See, diagnostic facilities are not available in district level, and even medical colleges. I would like to tell you here, the medical colleges are the ideal institute to set up comprehensive hemophilia care centers. Why? Because hemophilia is not just one profession. So pediatricians are needed, physicians are needed, orthopedicians are needed, dentists are needed, and even psychiatrists, sometimes counseling. So all these facilities available in medical college. We have more than 400-500 medical colleges in the country. At least half of these medical colleges take the step of establishing comprehensive hemophilia care, and this establishing diagnostic facilities in the pathology department definitely will give a boost in identification, diagnosing the most unidentified patients. That is one. Then the second one is again, we as NGO are actively involved in creating awareness in our society. We have taken up a project that mobile service unit. Why mobile service unit is needed for hemophilia? So why? Because awareness is less. And one more thing I want to share here. I have seen so many patients with brain bleed or life-threatening bleed on the way to Davangere. They died in the road. So this was really a lot of pain it gave. So that's why I was waiting how to address this. Then we advocated with the Rotary Foundation and Rotary, our local South Rotary, and prepared a project proposal for a mobile service unit. And Rotary Foundation readily agreed to give us a mobile ambulance, and 120-kilometer radius, any hemophilic, most of them are registered with us. Anybody has got a earliest manifestation of life-threatening bleed, for example, projectile vomiting and severe headache, means it is a brain bleed. So that time only factor has to be infused immediately without wasting even seconds or minutes. So that's why. So when they have these suffering, then they need not come to Davangere. They just pick up their mobile and call our mobile service unit. Our mobile service unit rush to his house and give factor first and bring him in the same vehicle to the city for further management. With this, we have saved a lot of life-threatening bleed children, and also we utilize this even conducting outreach programs, because as I told you, awareness is less. We even go to Hobli, Taluka level, and every 3 months or 4 months and conduct a awareness program. And when we were presenting to our principal secretary recently, and he was very much impressed. And why not we implement in the state? I told, sir, we wanted to gain some more experience, and we wanted to submit to the state government. This is a pilot project we have taken up, and you can to replicate in different districts. We will submit the proposal. No. Why you need to wait till that time? We have 108, and we can put 108 also in the in serving hemophilia and life-threatening bleed by providing home therapy and all those. Really, I was very happy about this development. But anyhow, we are working closely with our state government to realize the most effective to reach our blood brothers, to make their life very comfortable.
Is the same model replicated across India?
Yeah, that's what. See, now we can, yes, under NHM, so we can submit nationwide also, and see that the already the mobile 108 is there, and only we need to train the daycare center, and train the patients community, and implement this project. But maybe with our experience, I will share with NHM, and I will share with other state government to see that so this mobile service unit can be implemented at district level also, all over the country.
Thank you, Dr. Saab. What would be your message to the society? We are very happy. All the best, and many congratulations once again. What would be your message for our listeners?
Yeah, my message is yes, government. We want to work with the government, and we want to complement with the government. We want opportunities with the government, because as NGO we cannot take up the challenges efficiently. If government joins hands with us, nothing like that. That is one. Then the second one, to my blood brothers, I would like to appeal that you don't consider this as a disease, because we don't call this as a disease. It is a disorder, like a diabetes. Insulin is not there. We don't have factor 8 or factor 9. So that's why we need not become depressed. We need not have all these complexities, and we should, God has, we should consider this as an opportunity. It is an opportunity. See, I am born with hemophilia, and of course, hemophilia has given me lot of pain to tell you. So a lot of pain, and but I don't have regret, because I could become doctor. I could even today this award has come in search of me, recognizing my 40 years of services. What else we need? So this is the model every blood brothers should think. Don't get depressed. You can defeat hemophilia with your mental grit, and with our government arranging all these facilities to take care of you. Thank you.
You're also part of Doctors with Disability group. Any
Yes, sir.
Yes,
sir. Yeah. Actually, I am closely working with our the doctors with disabilities, and especially Dr. Singh is my friend, and we are working closely. Satendra Singh, I need to mention, and we are working closely. And especially last year, I got the Shrestha Divyanjan Award. That also has given me an opportunity to network with like-minded organization. And being a hemophilic, being a doctor, I want to involve in developing disability sector, each and everyone, to motivate them, inspire them, because of all these challenges I have taken up.
Thank you so much for giving us time from your busy schedule.
Thank you.
I am witnessing how many people are coming to you. and you are very busy, but still you take out some time for us. Thank you so much.
It is my privilege. Thank you, Danish. Thank you for listening. Thank you.
तो लिसनर्स, बात की हमने डॉक्टर सुरेश साहब से, जिन्हें पद्म श्री अवार्ड से सम्मानित किया गया है। उन्होंने अपनी जिंदगी के बारे में बताया, मिशन के बारे में बताया, कैसे डिसेबिलिटी होने के बाद भी आप कम्युनिटी में कंट्रीब्यूट कर सकते हो और इस तरह इस लेवल तक लोगों को जागरूक कर सकते हो। अगले सप्ताह मुलाकात होगी किसी और पर्सनैलिटी के साथ। दीजिए इजाजत, सुनते रहिए रेडियो उड़ान, फ्लाइट ऑफ लाइफ। बाय बाय।
यार एग्जाम पास आ रहे हैं, पुराने पेपर
देखे तो, लेकिन कुछ समझ नहीं आया, सब धुंधले हैं। मेरी स्क्रीन रीडर भी नहीं पढ़ पा रही।
अरे तूने स्मार्ट ऑन का डॉक्यूमेंट वाला फीचर ट्राई नहीं किया?
नहीं, वो क्या है?
स्मार्ट ऑन एक ऐप है। बस अपना पेपर स्मार्ट ऑन के डॉक्यूमेंट फीचर में खोलो और वो सब साफ साफ पढ़कर सुनाता है।
सच में? मतलब अब मैं खुद सुनकर पढ़ सकती हूँ?
हाँ, ये हमारी तरह के लोगों के लिए ही बना है जो अच्छे से देख नहीं सकते। अब पढ़ाई आसान है। स्मार्ट ऑन, ये पढ़ता है, आप सीखते हैं। तो आज ही डाउनलोड करो स्मार्ट ऑन गूगल प्ले स्टोर से।
ग्रोसरी मंगवानी हो तो ऐप इनएक्सेसिबल, शॉपिंग करनी हो तो ऐप इनएक्सेसिबल, फूड ऑर्डर करना हो तो ऐप इनएक्सेसिबल। अब इनएक्सेसिबिलिटी की छुट्टी, क्योंकि द एक्सेसिबल नेशन ऐप यानी कि टैन ऐप लॉन्च हुई है पूरे एक्सेसिबल फीचर्स के साथ। अगर आप विजुअली इम्पेयर्ड है या लो विजन है तो आज ही डाउनलोड करें टैन ऐप बाय महावंती सॉल्यूशंस ऐप स्टोर या प्ले स्टोर से, जो कि कनेक्ट करता है आपको Amazon जैसे ढेरों शॉपिंग स्टोर्स से। तो अब चाहे करनी हो शॉपिंग या मंगवानी हो ग्रोसरी, इंडिपेंडेंटली यूज करें टैन ऐप, वन स्टॉप सॉल्यूशन ऑफ योर डेली शॉपिंग नीड्स। ज्यादा जानकारी के लिए ईमेल करें support@buyfromtan.com, support@buyfromtan.com। कॉल करें 8209-735025 पर। और हाँ, इसी नंबर पर व्हाट्सएप मैसेज करके भी आप फूड ऑर्डर कर सकते हैं। है ना कितना इजी?